Everyone, and welcome to the 40th episode of Battles and Voices. I'm Athika, and I'm the founder and host.
And I'm Camden, and I'm the co-host, and we serve on the executive team of Vitals and Voices.
Battles and Voices is a podcast where people from all areas of healthcare come together to share their stories, experiences, and moments that shaped them to who they are today.
Now, please welcome our guest,
Hi, I'm
Paige.
Paige. Thank you so much for joining us on Battles and Voices. We're so excited to have you here. To start us off, feel free to introduce yourself and share a little bit about who you are and kind of what you do.
Yeah, thanks for having me. So nice to meet you all. My name's Paige. I'm originally from New Jersey on the Jersey Shore in a tiny little town there. I grew up in Cape May and then I ended up going to California for college. I went to UCSD and I stayed there for a couple of years. Then I moved to Chicago for medical school. I'm in my fourth year now, so about to graduate soon. Other than that, outside of medical school and everything. I teach yoga. I have a little corgi that I got when I was in college, so I hang out with my dog a lot and I go to a lot of concerts.
Well, it sounds like you've done a lot so far. So, again, you've said that you're currently a fourth year medical student at Rush Medical College in Chicago and now applying to dermatology residency. So, can you tell us a little bit about the stage of your journey and what it looks like currently?
Yeah, absolutely. So I always wondered this when I was in my pre-medical years, like how do you apply to residency and how does that all work? So in September of your fourth year, you end up applying to whatever specialty you want to go into. Some people apply to multiple specialties, but most people just choose one and apply to different programs in that specialty. And then from like October until February-ish, you'll have residency interviews with the different programs. Most of them are virtual, but some are in person. So some traveling here and there. And then after that, you rank all of the programs that you interviewed at, and then the programs rank all the people that they interviewed. And then in March is when match day happens, and kind of an algorithm will tell me where I'm going for residency. So right now I'm kind of in the midst of that, doing my residency interviews, and then there still are requirements for me as like a fourth year medical student in terms of like rotations, but most of them are elective rotations that I get to pick, and they're really fun. Tomorrow I'm supposed to start on gender affirming healthcare as a rotation, so that's fun. Yeah, and then after that I'll graduate in May and start residency.
That sounds really fun. So you shared that a conversation with your mom in high school deeply influenced your decision to further pursue medicine. So how did learning about your older brother's passing shape the way that you began to see healthcare and your future role in it?
Yeah, absolutely. So when I was a senior in high school, I was just kind of talking to my mom, and I always knew growing up that I had an older brother, but I just didn't really know the details of what happened to him. He passed away before I was born, but my mom shared that unfortunately, when he was only 4 years old, he passed away from a case of myocarditis that kind of went unrecognized, unfortunately. So yeah, when she told me this story, I hadn't really considered a career in healthcare. No one in my family was in the field or anything like that. But I was just really inspired by what she kind of told me about how the different healthcare workers that were helping with my brother's case helped her throughout the process, like the EMTs, how fast they got there, how fast they brought my brother into the ER, and then even just the ER doctors that reached out to my mom like a couple weeks later and sent her flowers after my brother had passed away. I was just really inspired by kind of the lasting impact that these people can have on patients' lives and their families' lives. And her just remembering these people 20 plus years later was really inspiring to me. So after that, I kind of thought about maybe this would be a field that I would want to go into because I always liked helping people, I liked serving others. And so that's kind of when I started to think about healthcare a little bit more seriously. And yeah.
I think that's really beautiful, as well as somebody whose family passing has also inspired their journey in medicine as well. I find that really touching and beautiful at the same time. And so after that moment, you became curious about, I'm probably going to say this wrong, myocarditis.
Yeah, you did it
Okay,
perfectly. You did it
perfect.
perfectly.
And you started learning more about detection and prevention. So how did that curiosity help solidify that medicine was just the right path that you wanted to take?
Yeah, absolutely. And so after she kind of told me about the story, I really just did a deep dive. I wanted to know like exactly what happened, like what is myocarditis? It's inflammation of the heart wall, and basically my younger brother just his heart stopped working essentially. Wasn't working as well as it should have. But I really did a deep dive on it. I really wanted to understand like the anatomy and the physiology and how all of that kind of led to this poor outcome, unfortunately. But I think just taking that time to kind of look into it more, I really realized that medicine might be a good path for me because I can study this long term. I realized it was something I was actually interested in reading about. And it also combined the ability of that like humanistic aspect of medicine as well, where I can help people, but also be intellectually like curious and want to learn more about things and get to the bottom of them. And if there isn't research on it, you can do more research on it. So that's kind of how I learned that I actually was interested in the content of medicine and not just the idea of helping people, more or less.
Really love that. I love how you like start from a beginning goal with your brother's passing, and now you're able to fulfill that goal going into residency. So, as your interests evolved, you were both drawn to OBGYN and dermatology, as you mentioned before. So, what ultimately led you to choose dermatology as a specialty that best aligned with your goals?
Yeah, absolutely. So I think coming into medical school, I had a couple of different like clinical experiences that kind of gave me exposure to both of these specialties. I worked as a medical assistant during my gap years in a dermatology clinic, so I kind of understood a little bit more about what would my life look like if I were a dermatologist. And I also had volunteered on the labor and delivery floor at like one of my local hospitals before med school. And OB-GYN, I really just loved working with women. I thought that they were a patient population that I could relate to, and I just really loved that I was there for them during vulnerable moments, such as like giving birth or having pap smears or just all these uncomfortable things us women go through. I wanted to be someone who could support them through those difficult moments. But I ultimately fell in love with dermatology for multiple reasons. I loved how visual it was. I loved that you could go in, take a look at someone and their skin and tell them exactly what it is and how to treat it. So there wasn't a ton of like imaging or lab work that you had to do to diagnose patients. I also really liked that there's patients of all ages, being able to see kids through adults, and then also just being able to see like entire families, which was really cool for me. Like seeing a grandson and a grandparent for multiple different reasons, like for eczema and skin cancer, for example. And I also really liked the ability to have the like continuity of care and establish a relationship with these patients. And then, yeah, I think I really did enjoy OB-GYN, but I think I kind of was missing that other piece of seeing patients who weren't just women all the time. Of course, I do still want to see women, and I hope to have like a dedicated clinic for my women patients, but I liked that Derm kind of gave me more exposure to a broader patient population, and I could still do procedures, but I didn't have to go into the operating room. Um, yeah, and I think the main thing that still comes makes me come back to dermatology is just how much of an impact on quality of life you can have for your patients. Everyone has skin, everyone knows how your skin can affect your self-esteem, your self-confidence, and even just like your ability to do activities that you want to do, like swim or run, because your skin condition will flare up if you do these things. You know what I mean? So I felt like it was a perfect specialty for me to be able to have that impact on quality of life while also combining all these other things that I really liked about it as well.
That is a beautiful reason to be so passionate with a specialty. Off topic, but you mentioned that you were like medical assistant. How did you become a medical assistant? Like, did you do like a program online or?
Yeah, that's such a good question. And I think after I graduated from undergrad, I wanted to just get more clinical experience before I went to med school. I graduated in 3 years, so I wasn't really ready to dive right into medical school right away. So I was just kind of looking for whatever job would take me more or less. And there were medical assistant jobs where they required a certification, which I would say the vast majority did. And the one that I ended up finding didn't require a certification. They kind of had like a month-long training process, like on the job, where I didn't need to get the certificate. But I do have friends like in my class who got an EMT license or did medical assistant certification before med school to be able to work in these like clinical jobs. But there are some out there that will allow you to do it without the certification, which I don't really know if it's legal now that I'm saying that, but I think it is. It must be. Um, but yeah, and I wasn't really looking for a job in dermatology necessarily either. I just kind of fell into it, and I'm really happy because we didn't really get a lot of exposure to dermatology during our first couple of years of med school. So it really gave me that experience that I needed to choose my specialty, if that makes sense.
Well, I'm glad that you were able to start off with some experience in dermatology. So, on to the actual question. Sorry about that.
That's okay.
So, you're deeply passionate about women's health within dermatology, especially for patients with vulvar skin conditions. So, why do you think these patients are often overlooked, and why is advocacy in that space so important to you?
Yeah, so just to give some background on vulvar skin conditions, it's any like sort of skin condition that affects the vulva or like the external genitalia in women. And I think the reason that these patients are overlooked, there's kind of a multifaceted reason for it, I would say. I think patients are often embarrassed or ashamed and don't want to bring up these concerns to their provider who's taking care of them. There's also kind of a lack of awareness amongst patients that there is like a name and a way to treat these conditions. I think they just think that this is something that's unique to them and no one else has it. You know what I mean? Because a lot of people don't about it openly. And then on the other side of it, I think there's a lot of uncertainty both on the provider aspect and on the patient side as to who to bring these concerns up to. Do you talk about it with your dermatologist or do you talk about it with your OBGYN? The answer is you can talk about it with either specialty. And I think also, some providers just aren't comfortable treating these conditions. Both in OBGYN, a lot of people are maybe more concerned about the internal aspect of things, and then in the dermatology side of things, people just don't feel equipped to be able to treat these conditions. So, this is something that I'm passionate about because I told you guys I really liked OB-GYN to begin with, and I really liked being able to still help patients in those vulnerable moments and really bring more awareness to these conditions. And I think that's why it's really important to me. And these conditions really have a big impact on quality of life in terms of interpersonal relationships. And these patients deal with a lot of discomfort, like burning and itching and pain. And that's just not a way that anyone deserves to live. And so I hope to kind of create a space where it's a dedicated clinic where patients can kind of seek me out if they have one of these conditions to be able to see a specialist in it so they're not kind of bouncing around between multiple providers and talking about the same uncomfortable story multiple times. So, yeah,
I really love that. And I love how you're able to, kind of advocate for that space.
thanks.
So you've also spoken about caring for pregnant and breastfeeding patients with chronic skin conditions. So what gaps do you currently see in care, and how do you hope to address them in your future practice?
Yeah, I think this isn't something that's just unique to dermatology, but I think a lot of the times clinicians will see a pregnant person or someone who's breastfeeding and they'll just kind of put their hands up and be like, I don't know how to deal with this. Like, I don't want to be the one who's managing anything while the patient's pregnant or breastfeeding just because they're kind of concerned about the outcomes for the baby and just pregnancy outcomes overall, which is completely valid. But I think at the same time, it's not fair to kind of put all of the work onto the OBGYNs for them to learn about all of the safety of different medications in all different fields and kind of knowing how to treat every single condition when a patient's pregnant. I don't think that that's helpful either. So I think kind of finding a happy medium between the two where providers in different specialties. They learn about the different safety profiles of medications, what you can take and what you can't take in pregnancy, what you can take while you're breastfeeding, what you can't take. Because I do think it's important to not just stop all of your medications, because especially in dermatology, too, some skin conditions in themselves, if they go untreated, they can lead to poor pregnancy outcomes and poor outcomes for the fetus as well if they're untreated. So it's kind of a balance between risk of treating and the risk of not treating, and just being able to have those conversations with patients so they can make an informed choice as to how they want to treat their condition during pregnancy is super important. And then I think how I want to address it in my future practice is just kind of staying up to date on all of the different medications that keep coming out. I'm sure you guys see all the commercials for all the new skin medications, the injectables and the pills and everything like that. So just staying up to date on those safety profiles as new medications come out so that I can kind of really have those meaningful conversations with patients, because ultimately I don't want them to go off of their medications and have their skin condition flare and then they're itchy throughout pregnancy when they're already uncomfortable. So yeah, I hope that answered your question.
It definitely did. And also just very important as well, because again, they're pregnant and you don't want them to be more uncomfortable than they probably already are, or maybe even like less confident, if that makes sense. I'm hoping
Absolutely.
because like again, how you said earlier, how skin is feel more confident, especially. So as a first generation college and medical student from New Jersey, what challenges did you face early on, and how did your background shape your resilience?
Yeah, so my background, I would say, like to give more context as to where I'm from, it's a tiny little beach town on the Jersey Shore. I didn't really grow up with a ton of people who live there year round. A lot of people come visit there in the summertime, but during the winter, there's not a lot of year-round residents. So I think there's like less than 3,000 people or something that live there year round. So it's really small, and I think the like main challenges that I faced early on is just I didn't have a lot of mentors or people to up to that I knew were in medicine, not like in my family or really in my community either. I also feel like the other challenge I had was my parents didn't go to college, so they weren't really aware of the impact of student debt, and neither did I. I was 17 and I was like, okay, I can go to college in California. Sounds good. Let me sign the papers. But then kind of learning on a couple of years later, I realized how much I was actually taking out in student debt over the course of my time in undergrad. So that's why I ended up graduating early. But I think just having these experiences really shows me like the importance of being able to be there for younger generations of students who are in high school or in undergrad who are looking to go into medicine, because I think it's really important to have someone you can ask questions and look up to. And I think they just taught me to be more resourceful. Like when I had to pay my student loans, I ended up babysitting on the side so I can make the payments, and um, also just like reaching out to people that maybe are like unconventional for mentors, like people who I knew from college who were a couple years ahead of me, who weren't like totally doctors yet, but they had gone through the process. So those were people I could turn to for advice if I needed to. So just being more resourceful and kind of working with what I had, you know.
Definitely have to agree with you. I also come from a very small town in South Carolina. So yeah, I definitely have to agree with you.
I'm sure you can relate. Yeah.
Yeah, definitely. So you mentioned how meaningful a mentorship has been during medical school. How have your different mentors influenced the physician that you hope to become, and how do you plan to pay that forward?
Yeah, absolutely. Like I said, during undergrad, I didn't really have a lot of mentors, but throughout medical school, I feel like my mentors have really shaped my career goals. I think one of my biggest mentors, she's really big into women's health and dermatology, and kind of showed me that there is this way for me to combine my interests, and showed me that I could also do that in the future. And she has like a dedicated clinic for her vulvar skin patients, and also for her pregnant patients. So that kind of shaped kind of my ultimate career goals. And she also has just been super supportive and helping me get different like research opportunities and leadership opportunities and connecting me with the right people. So they have like both influenced who I want to become, but also have like really helped me to be able to get to the point where I'm at now, where I felt like I could apply to this specialty and felt prepared for residency. And so I think moving forward, I think I just want to be a mentor for anyone who needs it, whether or not they're going into dermatology or not. Especially for people who are in high school and are first generation and their parents don't really have anything to offer for them. Like, I would love to help them navigate kind of the process of going to college and the FAFSA and the financial aid and just kind of offering like my experience because I just didn't have that from other people. And similarly, applying to medical school and what you should write in your essays and how to interview and things like that. So I think I would just love to mentor people in that way and also just medical students as well who are in the position that I'm in now when I'm in attending. I hope I can help them reach their goals ultimately.
That's beautiful. And hopefully you get to mentor someday. And that'd be a full circle moment, honestly. And I think that's really amazing. I hope to do that someday, honestly. I think Latika can agree with me too. So, one of your proudest accomplishments is actually authoring a textbook chapter, medication safety during pregnancy and lactation. And how did that experience teach you about yourself as a clinician and a scholar?
Yeah, absolutely. Thanks for asking about this. I think this was like my most meaningful project that I did throughout medical school. For certain specialties, like research is something that residency like committees really value in terms of like the candidates that they're looking for. So I always was kind of doing some sort of research project, but this one I think was most meaningful to me because it was the biggest project I had to do. I had to pretty much look up the safety of every single medication that's used in dermatology and kind of synthesize all the different sources where you can get this information from. Oh my gosh, your dog's so cute. And just make it concise, but also make sure it's the information that people need. Like, what are the risks if you use it in pregnancy? What are the risks if you use it in while people are breastfeeding? And kind of giving it a grade as to like, is it proven to be safe or is it not proven to be safe? And I think the challenge is a lot of the times clinical trials don't include pregnant patients or patients who are breastfeeding just because it's kind of unethical to have pregnant or breastfeeding people in research trials because they're not sure about the outcomes. So a lot of the data on this topic is like kind of experimental or just like based on like one-off cases that people report in the literature. So I think in this project, especially since I was kind of able to do it from start to finish on my own, really allowed me to kind of deep dive into this topic and taught me how to kind of synthesize information from a bunch of different sources and kind of weigh the risks and benefits so that people who hopefully will read this chapter in the future will be able to use that and kind of apply that to patient care. Yeah, I think it'll be published later this year, so it's not published quite yet, but I'm excited to see it in the textbook.
That sounds amazing, and congratulations again, Paige. That's honestly so amazing that
Thank
you
you.
were able to do that. Yeah, of course. And to wrap things up, as you prepare to graduate and move into residency, what advice would you give to students who are from small towns or first generation backgrounds who dream of pursuing medicine but don't always see a clear path forward?
Yeah, absolutely. I think if you really want to do it, you definitely can. Like I know there were so many people along the way. Like my school guidance counselor in high school was like, "Do you really want to do pre-med? Like not a lot of people from here do pre-med." And like my pre-med advisor in college was like, "I don't know if you'll get into medical school." So there's a lot of people who will kind of try to tear you down and maybe deter you from it. But if it's like truly the only thing that you can see yourself doing and being happy with in the future, I think you should definitely pursue it and don't let those people get to you. And I think don't be afraid to just email people. Like the power of emailing people is real. Like if there's a someone also on social media as well. When I was like applying to colleges and med school even, like social media wasn't that big of a thing. Like if there's a doctor that you really look up to on social media or a resident or a medical student like and you want their advice, like you can just send them a DM or send them an email. You might not get responses from everyone, but I think being able to connect with these people early on, they can give you the advice and the support you need like throughout the process. And yeah, just don't give up. It'll all work itself out eventually. And just knowing that everyone's kind of on their own timeline, like you don't have to go straight from undergrad into medical school into residency. People take gap years all the time. People take research years all the time. So taking it at your own pace and kind of having your own journey is honestly, I think, what's so unique about medicine too. And it helps you grow as a person and bring unique experiences to your class as well. So I hope that answered your question.
Um, that was some wonderful advice, and thank you so much, Paige, for sharing your journey, your passion, and the impact that you hope to make on in medicine. Sorry.
Your dedication to women's health, mentorship, and compassionate care is incredibly inspiring. And we're so grateful that you shared your story with us on Battles and Voices.
Thanks for having me. Thank you.
Thank you for coming on again, and to everyone tuning in, thank you for joining us on for episode 40. And your support truly means the world to us.
If you enjoy this episode, be sure to follow, share, and stay tuned for more conversations on Battles and Voices.
We'll see you next time.